The organization that will lead the province's first supervised consumption site says more consultation is to come. The Manitoba government and the Aboriginal Health and Wellness Centre have faced criticism for not talking to some area residents and businesses before the location at 200 Disraeli was revealed. As CBC's Josh Crabb reports, they're highlighting the benefits of the site.
The timeline for a Health Canada decision on Manitoba's application to open a supervised consumption site here isn't known. The organization picked to run it promises people will get a say before anything is finalized.
Hang tight, it's still coming. And just because an application goes in, that does not mean that that's an endpoint.
The site will give people a place to inject their own drugs in the presence of trained staff. But that's raised concerns for some in the neighborhood who say they weren't consulted on the location. Monica Sear with the Aboriginal Health and Wellness Centre says they have spoken with area shelters, harm reduction groups, and a residents committee, and prioritized talks with Argyle Alternative School and daycare centres nearby.
In terms of when should the address be released, we were taking our lead from government partners.
Speaking after a charity event, Premier Wab Kinew says safety concerns won't be ignored.
But this is not a foregone conclusion that the site is going to open here at this location. We don't have a specific date in mind, and it will not open until we're satisfied that it is safe for the surrounding community.
The decision to select this as the location comes as Ontario announced it's closing 10 supervised consumption sites because they're too close to schools and daycares. That province's health minister cited higher crime rates and concerns from area residents. But researchers have said it will leave hundreds without access to a site, which they say will lead to more substance-related deaths. Preliminary numbers in Manitoba show there have been 323 suspected substance-related deaths so far this year. There were a total of 445 in 2023. Charlene Hallett is the site's cultural and health integration lead. It will have nurses, healthcare practitioners, and wraparound supports.
We hope that we will be able to save lives from people who might otherwise have an accident or an overdose.
A rapid access to addictions medicine clinic will be moved to the site. The goal is to create capacity to serve more than 200 clients per day. Josh Crabb, CBC News, Winnipeg.